key is to think in terms of strategic interoperability, looking beyond a single transaction or beyond a single compliance use case. So 3 specific ones come to mind. The first one is around value-based care enablement. And when you have parties participating in a value-based care arrangement, they want to understand how they're performing, just like you want to understand how your stock portfolio is performing, and you want to understand more frequently than every quarter or once a year. And so by having real-time granular performance reporting and insights for providers who are participating in those arrangements, you enable them to better understand their performance against the factors driving their incentives and reimbursements, and enable them to maximize the value they create and capture, which ultimately results in better progress against the quadruple aim, and you end up with better and more engaged networks. And so by enabling interoperable solutions to interact with the data that underpins those performance measures and payment streams, you allow them to participate in the process of improving performance and therefore be able to help advance the goals that you're trying to achieve. The second is around risk adjustment, coordination, and optimization. So driving suspects all the way to the point of impact or to the point of care really reduces the burden and waste and rework on already strained clinical and administrative teams by preventing them from having to correct or otherwise revisit documentation that's been considered complete. Second, richer data sets that you enable by having a wider range of participating systems. So I'm pulling from labs, I'm pulling from EMRs, I'm pulling from other partner systems, enables more precise targeting and more effective assessment and intervention prior to a visit and prior to engagement with the member. And then finally, in the space of care management and coordination, member stratification and care program design powered by more comprehensive data sets really enables selection of more precise and appropriate care pathways for a given member. Coupling that with real-time collaboration across care teams ultimately leads to better outcomes at lower costs, at the same time reduces the burden on both plans and providers. So it's a sort of a taste great and less filling scenario because you're making sure that you're eliminating uncertainty and working together towards the aim rather than having independent decisions and independent actions that may or may not reconcile against one another.